Hey guys, this is Dr. Hub. Today we'll look at the cartilages and their types. So there are three varieties. First is the hyaline cartilage. So to recap the few important points, the hyaline cartilage contains the chondrocytes in the lacunae. And there is also the presence of the matrix. The second variety is where there is the fibrocartilage, and the significant features includes the chondrocyte in the lacuna, and there is also the presence of the collagen fiber which is present in the matrix. The last variety is the elastic cartilage. The elastic cartilage, it contains the chondrocyte in the lacuna as well as the presence of the elastic fibers in the matrix. Now let's break each of them down and discuss in detail. So first we begin with the hyaline cartilage. So under the hyaline cartilage, what is the color? The color is, it is a bluish opalescent. So it is bluish opalescent. And how is the collagen type? The collagen type is 2. So the collagen type is 2. Then how is the perichondrium? The perichondrium is present. So it is present, and there is an exception. So it is present except at the epiphysis and the articulator cartilage. So except the epiphysis. So it is present except the epiphysis and the articulating cartilage. Next, the question arises on the calcification. So talking about calcification, it occurs in terms of the old age. Now, what are the cells which are present in terms of the hyaline cartilage? So the cells which are present in hyaline cartilage, it includes the chondroblast. So there is the chondroblast as well as the chondrocytes. So this chondroblast as well as the presence of the chondrocytes. So what about the fibers? The fibers is, there is presence of the thin collagen. So there is presence of the thin collagen. Now let's look at some examples of the hyaline cartilage. So the examples of the hyaline cartilage, it includes the arytenoids. So there is the arytenoids, and there is except. So it includes arytenoids except for apicus. So except for the apicus. Then there is the cricoid cartilage. We are writing it as CC. Then the thyroid cartilage, let's write it as TC. Then there is the trachea and the bronchi. So let's write it as T and B. Then the articulating cartilage at the end of bones. There is articulating cartilage. So this articulating cartilage is at end of bones, at end of the bones. Then there is presence of the epiphyseal plate. There is epiphyseal plate as well as a costal cartilage of the ribs. So the CC of the ribs. Lastly, the other example, there is the involvement of the temporary skeleton. So there is temporary skeleton, and this is in terms of the embryo. So post this, let's look at the elastic cartilage. So we are diving into the elastic cartilage. So the color in the elastic cartilage, it is yellow. and the collagen type is going to be type 2. So is the pericardium present? Yes, the chondrium is present. So what about the calcification? The calcification, there is no calcification. And what are the cells? Cells involved is the chondroblast and the chondrocytes. So it's very similar to that of the hyaline cartilage. There is a chondroblast. So there is presence of the chondroblast as well as the presence of the chondrocytes. Then let's look at the presence of the fibers. So there is presence of the fibers. So under the fibers there is the elastic fibers. The presence of the elastic fibers. So what are the examples here? The examples here, it includes the apices of the arytenoid. There is apices, and this is of the arytenoid. So there is apices of the arytenoid. Next, there is presence of the epiglottis. There is a corniculate cartilages. So let's write it as CC. And there is also cuneiform cartilages. So this cuneiform cartilages. There is corniculate cartilages. Then there is ET, that is a eustachian tube. There is also the presence of pinna, that is the auricle. So pinna is nothing but the auricle, and the external auditory meatus. The external auditory meatus is known as the EAM. Now lastly, we move on to the fibrocartilage. So the fibrocartilage will be the third variety. So the fibrocartilage, the color is going to be white. So fibrocartilage, the color is going to be white. And what are the type it includes? The collagen type is that it is 1 and 2. So it includes 1 as well as 2. So what is about the pericardium? The perichondrium is absent. So it is absent here. Then what about the calcification? The calcification it occurs only with the bone repair. So the calcification, if you see, it occurs, and this is occurs with the bone repair. So it is present, and it is present along with the bone repair. So what are the some cells which are associated with this? The cells associated, it includes the fibroblast. So it includes the fibroblast as well as the chondrocytes. So fibroblast as well as the chondrocytes. And what will be the fibers? The fibers involved is the thick collagen. The fibers involved is the thick collagen. Now let's look at some examples. The examples are, there is an articular disc. There is articular disc. An articular disc is nothing but example of the temporomandibular joint. So it is nothing but the TMJ, and the sternoclavicular joint, and SEJ. Then the fibrocartilage, it also includes the intervertebral discs. So intervertebral disc. Then there is the menisci. There is also the glenoid and the acetabulum labrum. So there is glenoid and the acetabular. The acetabulum labrum. Then there is presence of the pubic symphysis, the manubriosternal joint, manubriosternal joint, and the lining of the bony grooves for tendons. So there is lining of bony grooves. So the lining of the bony grooves, and this is for the tendons.